A teenager's wrists zip-tied, patient's shoes taken so they can't run away, and a closet full of medicine left unlocked.
What I'm hearing from your reporting is this is just straight-up abuse.
In a Channel 9 investigation, we obtained state records detailing horrifying conditions at a treatment center for at-risk teens.
I'm scared.
Now at 6, families' heartbreaking dilemma as they figure out where to turn next.
What are we supposed to do?
You can hear the frustration in her voice. Channel 9 first told you last night that part of Anderson Health Services in Marshville was forced to shut down.
And since then, we've continued to dig through the state records. We've questioned experts and even talked to one patient's family. They called us concerned about her safety. Eyewitness News anchor Liz Foster joins us now. Liz, you've been digging into the violations, but now one of the worst ones, a child really just tied up with zip ties.
Scott and Erica, I have found disturbing details while dissecting dozens of pages into these state reports into this one facility. Over and over again, state investigators detail how Anderson Health repeatedly failed the teens staying there in need of mental health care.
In a 9 investigation, I obtained this state report done at Anderson Health Services in April that details licensed staff members restraining a 14-year-old girl who has a history of physical abuse with zip ties around her wrists and legs and leaving them for over an hour.
That should never, ever happen. That's shocking to me.
Dr. Frank Gaskill is a psychologist who specializes in behavior difficulties with kids. He was appalled when I shared with him some of the state findings at the Marshville facility and shared what should have been done during an aggressive fit by a patient, what's known as a soft or therapeutic hold.
It's got to be without causing harm. It's got to be done in a warm but authoritative way and without abuse. And what I'm hearing from your reporting is this is just straight up abuse.
Other concerning findings include a registered nurse not locking the medication room door because it was, quote, a pain. The facility taking away the teen's shoes for the first 30 days they're at the center to prevent running away. And more. Despite state investigators visiting the facility in April and verifying the zip tie incident, the Department of Health and Human Services didn't order Anderson Health Services to shut down 2 of its residential cottages until 6 weeks later, after more violations were found on Friday.
How did they let this go on for so long? That's the question I keep asking in my mind.
Aisha and Ron's 15-year-old daughter is still at Anderson Health as the agency Cardinal Innovations works to find another treatment facility.
Cardinal keeps saying, we're going to find her a place. When? If this is an emergency, why don't you have something in place? You're waiting on referrals. What if something happens to her?
That family told me they're doing everything they can to help find another treatment facility for their daughter, but they don't have the final say in that. State investigators did slap that facility with a $3,000 fine for that zip tie incident and classified the violation as serious abuse. And we do want to note an attorney for Anderson Health told me he filed an appeal to the state suspension.
We talked a lot recently about trying to get more money for funding for mental health.
Yes, and people are concerned about all issues, caring for these kids and issues of school shootings as well. So want to make sure that all the children are taken care of.
Absolutely.
Thank you, Liz. When we started doing the research today to track down the funding for facilities like this one, we were really shocked by the massive cuts that have taken place across North Carolina. Agencies that provide funding for mental health have been cut by more than $86 million this year in their budgets, and another $90 million expected for next year. The agency that provides the money here in the Charlotte area was cut by $20 million last year and another $25 million for next year. One mental health advocate that we talked to today said it's so bad that families that need treatment facilities like these are often told to move out of state to find care for their children. Channel 9 has posted the full 72-page state report on our website, WSOCTV.com. You can see that inside this story posted on our homepage.